Hi, welcome back to PARC Parent Pointers. I'm Bree. If you haven't seen some of my previous videos, I go into what to expect for surgery, frequently asked questions, Tylenol, Motrin, pain medication, and last week was a really special video talking about if your son was told that he only required one surgery for a surgical repair, what to expect post-op. This video is very similar, but except, or in that we talk about post-operative care. But for this video, we're talking about if your son was told that he requires 2 surgeries to repair his hypospadias. This is the initial surgery, the very first one, and what to expect. So your son has had surgery, you're heading home, and I'm sure you're wondering what you're going to expect with that first diaper change. So when you give him his first diaper change, you'll notice that he's going to have some white gauze that's protecting the surgery site and is held into place with a big plastic outer bandage. Poking out, you'll see a catheter that is coming out at the top of his tummy, and it's taped down, secured into place. That is going in, and obviously urine is going to just come right out over top of the bandages. Don't be concerned because of that. Just wipe up everything like normal, diaper change like normal. And for some patients, those bandages will fall off the same day because of the urine, because of how active he is. Sometimes it takes a couple of days. Regardless, don't worry. You don't have to worry about rebandaging him or anything in that regard. Instead, put Aquaphor on the top of his diaper to protect him when those bandages fall off, to prevent any sticking onto the diaper, and just to provide some comfort because things will be a little sensitive and more raw in that area. In regards to the bandages, if he has a poopy diaper, clean everything up like normal, just like you would a normal diaper change. You don't have to do anything different. You can use the same kind of wet wipes. Whatever you use is totally fine. This catheter will be in for 7 days. Notice that it has kind of a V shape. This is considered a Foley catheter. Out of one end is urine and the other end holds the balloon. So keep that in mind when you're taking out the catheter. If you happen to be someone who's taking it out at home, or if you have a family friend doing it, which is totally fine, just realize that there's 2 different ports on this particular catheter for the first stage of surgery. And like I said, it's going to be in for 7 days. 6 to 7 days in order to make sure that everything is good healing wise and that there's no discomfort when we take that out and he urinates on his own. Other than that, ointments, we talked about the ointments, we talked about the bandages, we talked about what you'll see. But the biggest thing is just making sure that if you have any questions or concerns that you let our office know. This first stage involves a graft, whether it's circumcision skin, whether it's oral mucosa. We want to make sure that it gets its own blood supply. We want to make sure that it's healthy, so that Aquaphor, keeping it moisturized, is our big key tip. Additional to that, a month after surgery, you'll begin a steroid cream that you'll apply morning and evening. We typically recommend first thing in the morning and then at nighttime right after bath time. That way it gets into the skin. You might notice some redness, you might notice a little irritation. That's not necessarily irritating him, it's just that the cream is working. So it's stimulating that skin, increasing the blood flow, increasing elasticity, doing exactly what we'd like. We also have our post-operative paperwork written out for you. That way, if you have any questions or concerns, you can go ahead and read through this. All of our local patients get it about 2 to 4 weeks before surgery, and our international out-of-state patients get it before surgery as well as during the day before surgery during the preoperative consultation. Now, once these bandages come off, I'm sure you're wondering what to expect. It's a little overwhelming if it's not something that you see day to day. He's going to have an inner gauze bandage that's rolled up. So it's this white gauze rolled up, and it has a Vaseline material on it. That is applying pressure onto the graft, and it's stitched in. So when the catheter comes out, you'll also be removing that inner bandage and the blue stitches that you might see across it. Most of the time, there's about 3 of those stitches, kind of like railroad tracks, and sometimes there can be up to 5. But you'll remove that, the inner bandage, as well as the catheter. The outer bandage will not last that long, the tape will not last that long, but the inner bandage and the stitches most likely will. So expect to remove those. Once that comes off, you want to completely slather the graft with Aquaphor. You want to emphasize, keep it super moisturized, up to 4 to 5 times a day if your kiddo is not potty trained and with every diaper change. For our older kiddos, using like a maxi pad, putting that in their underwear can help release or reduce some of the mess that Aquaphor can cause, but we want you to keep it super moisturized. You'll do that up until the steroid cream, and then you'll still use the Aquaphor with the steroid cream, but you'll substitute 2 applications for steroid cream. So steroid cream in the morning and at night, Aquaphor all throughout the day. And once you stop the steroid cream after about 3 months, you can stop the Aquaphor as well. Maybe continue once or twice if you notice some dryness or peeling, but that kind of depends on the weather, the time of surgery, things like that can kind of factor in. But it's always good to keep it moisturized and make sure that that graft is nice and healthy. But if you have any questions or concerns or specifics in regards to your son, give me an email. Go ahead and call me, and I'll be happy to answer any questions that you have. We'll see you next week, and we'll talk about what to expect in the final stages when we roll up his penis and the graft is healthy and good. We'll roll everything up, and we'll be done with surgery. We're finally done.